Let's be real. There's a lot of rewards that come with working in mental health. And also, sometimes our clients can be just downright frustrating for us. Today, we're going to talk about why you're feeling frustrated at your client and what to do about it. If you are new here, my name is Lauren and welcome to my YouTube channel. I am a licensed therapist, board-approved clinical supervisor, and private practice owner. Full disclaimer, while I'm not your clinical supervisor, I am someone who genuinely believes that everybody deserves good clinical supervision. They deserve to have knowledge on all the different topics that come up, skills to help them feel confident and competent as they're working towards licensure, and even having this knowledge after you become licensed wherever that road may take you. And so if you're new here, please subscribe and follow along so that you can always stay tuned to what we're talking about and get answers to all your burning questions. And as always, because I'm not your clinical supervisor, please seek clinical supervision and consultation for any specific questions that you might have related to your clients, the work that you do, and just it's good to have clinical supervision. All right, so you're feeling frustrated with a client. I've been there. And anyone tells you they've never been there as a therapist, I question that because we're human. We have emotions. We can feel frustrated. And as a mental health clinician or therapist, it's really easy to get really involved and wrapped up in the work and want what's best for your client. And if you see a client struggling, not taking your suggestions, not following through on things, they are exhibiting, unhealthy behaviors, it's really easy to feel some frustration there because we naturally want to help people and we don't want to see them struggle. That being said, feeling frustrated with your client can be really, really problematic to the work that you're doing. It can cause you to lack empathy. It can cause you to show up differently. It can cause you to say things that you wouldn't normally say. And we are to do no harm to our clients. And so if we start to feel frustrated, we need to be aware of that and actively taking steps to address those feelings, to reduce those feelings, and to stay present and focused on what the client is working on because they need us to be a neutral party. They don't need us to be frustrated at them. They're likely already frustrated enough at themselves in their situation. So why are you frustrated? Here are the most common reasons that I see mental health clinicians and pre-licensed professionals getting frustrated. The first is that you and the client have two different agendas. Now, you might be thinking, I'm not supposed to have an agenda. This is about the client. And you're right. And again, we're human. And so it's understandable if the client's goal is to feel less anxious. And you're over here going, yeah, but I think it would be really helpful if they left this relationship, which is causing them to be anxious. That's a different agenda. The client is saying, I just want to feel less anxious, but they're not necessarily saying, I want to address these problematic relationships. I want to set boundaries. I want to learn to communicate. I mean, all those things could be helpful. And I'm not saying that they're not because I have seen that drastically help reduce anxiety. But if your agenda seems to be, I really want to get them to this point, and that's not their agenda, or they're okay with not getting to that point, then that's going to clash. And it's natural that you might feel some frustration about where they're at, the progress that they're making, and the things that they're not doing that you might be sitting here going, I really think you should do that, or I know that that's going to be so helpful if you give it a try. How do you address this? We want to make sure that our agenda is not eclipsing their agenda, and that if you notice I'm getting frustrated, take a second and ask yourself, do I want more or different for the client than they're wanting to work on? If my agenda does not match up with their agenda, I need to take a step back because it's not about me. And I need to be able to say, this isn't about me and this is about them, and where they want to go and where they land is okay. And it is good enough. Even though I might be striving for excellence, if it's okay for them, it needs to be okay for us. I don't have to co-sign on that. I don't have to say, I agree that you should stay in this negative or unhealthy situation. But if that's what they want to do, I need to be able to respect that that's their agenda, that's where they are, and my desire for where they should be can't interfere with that. I need to be able to be neutral and respect that that's where they want to be, that's where they are, and there's no changing that. The second reason that I see happen so often is you're working harder than the client. So you're feeling frustrated because the client didn't do their homework. And this is the third time that you've assigned them this homework. And you're feeling frustrated because, oh my gosh, how easy is it to just go and do it? Well, first off, something's happening that it's not that easy. And we want to figure out what that is and help the client understand what's keeping them from following through on plans or goals that they've set. But also, if I am working really, really hard to get you someplace, to talk about something, to open up, to address this thing, to try this new coping tool, and you're like, I don't know if I'm really ready to do that, or I'm just not really bought into that, or I'm not fully committed, then I end up working harder than the client. And I can't do that. I can't make changes for you as a client. I cannot improve your communication as a client. I cannot make sure that you're navigating situations and stressors well as a client. I can't control what happens outside the therapy session with the client. And so I can't try to do things to help them in a way that is way, 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 way more than what they're doing to help themselves. I can't work harder than them. So if you are feeling frustrated, take a second and think about a client that's really frustrating you and ask yourself, who's working harder, me or the client? Another thing I see is unrealistic expectations or goals. If you are expecting the client to act the way that a previous client did in a similar situation, or how you would in a similar situation, that's unrealistic. The client is who they are, and they have their own set of unique challenges, viewpoints, beliefs, support networks, their own history, their own coping strategies. It's all unique to them. And so it's not fair or realistic to expect them to get somewhere that other clients have gotten to before, or that you yourself want them to get to, or that you yourself feel like you could get to if you were in their shoes. That's not realistic. And if you find yourself being frustrated with them, we want to take a step back and go, am I expecting them to do something that's realistic to their situation? Because I'll give you an example. If you're working with someone who is in a domestic violence situation, and they say that they want to stay safe for them and their kids, and so you're expecting that means that they're going to leave and stay away from that abuser. And then they go back to the abuser after they've left. And you start to feel frustrated. Understandably so. It can be frustrating to go, oh, I know that this is going to be a bad situation, or I know that this is probably going to not be healthy for you or the kids, or I'm worried about you and your safety. But if I start to feel frustrated with you about that because I was expecting you to not go back to him or her, and you did anyways, then I've now put myself in a situation where I'm frustrated at you for you doing what you feel like is best for you. Well, that's not fair. I don't want to put that type of pressure on you as a client, and also it's not about me. And so making sure that your expectations are realistic, that the goals that are set are realistic, is really, really important to keeping you from feeling frustrated. And if it happens and you find yourself going, I'm so frustrated, again, take a minute and look at, all right, am I expecting them to do something that they're not doing? Am I expecting this to go differently? If so, I need to be realistic. I need to not have an agenda like we've talked about, and I need to try to stay neutral and not have any expectations about anything, and hope that with our work together that they will help make change in their life. But if they don't do that, that's on them. The other piece is that expectations can lead to disappointment, and being disappointed in the client is not great. And there's a lot of things that can come up when we start to feel disappointed with a client, and we want to be sure that we are being attentive to that and seeking supervision around that, because that can impact the work that we're doing with the client in a negative way. This next reason I see so often, and that is you're lacking boundaries with the client. And this is really important because as therapists, we need to have good, healthy boundaries that we set and model for the client. And if I'm frustrated with you because you're doing what you do, and I'm noticing that I'm starting to feel upset, maybe I feel taken advantage of, maybe I feel disrespected, I'm feeling frustrated, I want to think for a second, does this have to do with lack of boundaries? Because if so, I need to be the one to change the course here and set healthy, more assertive boundaries. And if I've never told you what those boundaries are, then I need to start there. If I have, but I'm not upholding those boundaries or maintaining them, I need to do a better job of that, because clients will do what they need to do to get to where they need to get. I'll say that again. Clients will do what they need to do to get where they need to get. And so if I, as the client, need you to be okay with me being 15 minutes late, then I'm going to do what I need to do to get you to be okay with that. And that might be telling you that I'm sorry, telling you that it'll never happen again. even if it's happened 3, 4, 5, 6, 7 times. And this is not a negative in regards to clients. This is human behavior. We do what we feel we need to do to get what we feel like we need to get. We all do this. And so being aware of what your boundaries are and setting and maintaining good boundaries allows you as the clinician to not feel disrespected, to feel less frustrated, and to maintain a good, healthy working relationship with that client. So make sure that you have good, healthy boundaries in place and that those boundaries are being made aware to the client and that you're maintaining those boundaries and calling attention to times where you feel like that someone is not respecting your boundaries or they're violating those boundaries in some way. Because again, all this does is negatively impact the work. So we have to make sure that we're doing these things. I started alluding to this next piece earlier and I said, think about the situation in terms of what you would do if you were in the client's shoes. And this is the next thing that I see trip people up and really cause a lot of frustration. And that is you are over identifying with the client and or their situation. I've said this in other videos. It's so easy to look at a client and think, if I was in their shoes, this is what I would do. I would just leave that relationship. I would just quit that job. I would just tell that person off, whatever it might be. But I'm not the client. I'm not in their shoes. I'm totally different. I'm looking at it from my perspective. And so I want to make sure that my frustration is not coming from a place of I'm starting to over-identify with the client and or their situation, and I'm finding myself having a hard time having a degree of separation emotionally where I'm not overly invested. Because if I'm overly invested, I'm over-identifying with the client, then it can negatively impact the work, first and foremost. But also, I then become the person who seems to be driving this change. It's what I think, it's what I want, it's what I would do in the situation. And this has nothing to do with me. It has to do with the client. And if the client doesn't want to leave that job, even if you're looking at it going, I think you'd be a lot happier if you did, the reality is that it doesn't matter what I think. It's about them. And instead of how do I get them to leave this job, my thought should be, how do I support them in working through this? And how do I help them identify what they can do to cope with this stress, to be happy given their circumstance, and to also feel confident in themselves to make the next decision that feels the best for them? Again, it's not about me. So if I'm starting to over-identify with the client, seek supervision, talk to your supervisor, reflect on what's happening for you in this moment, try to take a step back and really try to look at it from their perspective and what they want and what they need, not what we think is best. All right, this last one is really, really important. If you've listened to nothing else, I hope you're still here because this is the thing. I oftentimes see that mental health professionals, they get a hero complex. And because of this hero complex, they feel really, really frustrated with clients. It happens. We all get into the profession of mental health, whether that's social work, whether that's being a licensed marriage family therapist, whether that's being a behavioral specialist, whether that's being a licensed professional counselor, whether it's a psychiatrist, a psychologist, whatever it is. We all get into this profession for some reason. And most of the time I hear that reason is, I want to help people. And so naturally, when you want to help people, it's understandable to become invested in that, to become invested in the work, to be bought into the process, to be emotionally connected to the client, to want what's best for them, to want positive outcomes, to even fix or change things about their situation, to solve their problems. But this is the problem. I can't be their hero. I'm not here to fix people. The person who needs to fix their situation is the person whose life we're talking about. My job as a therapist, my job as a clinical social worker, it's not to fix a client. And your job, wherever you are, whether you're pre-licensed in your residency or you're already licensed, your job is not to fix your clients. You're not their hero. You ain't swooping in with a cape and making everything better. That's not realistic. That's not healthy. That's not your role. And if you find yourself wanting to fix the client, you're also probably, like we said earlier, probably working harder than the client. You probably have unrealistic expectations. You're probably over-identifying with their situation. And we need to take a step back and have some good, healthy boundaries and recognize what's on their side of the street and what's on our side of the street. Because they're driving the bus. Your job as a clinician or as a therapist is to be the passenger. I'm here to help support you. I'm here to help guide you. I'm here to make sure you're not alone. But you're the driver. So if I say I think it would be a good idea to try going right and you say, no, I'm going to go left, okay, we go left. And I'm still going to support you. I'm not going to abandon you. But I can't save you. So if going left means that you jump off of a cliff or that you drive into a ravine, well, obviously hypothetically speaking, okay, we'll figure out how to deal with that when we get there. But I can't fix that. I can't solve that. I can't swoop in and be the hero. So if nothing else from this video, I hope that you are getting this reminder that you don't need to come in here and fix things. You don't need to come in here and change things. You don't need to come in here and be everybody's hero. And if you do find yourself in those roles, you're going to be frustrated because you can't get someone to do anything that they don't want to do. You can't work harder than the client. You can't expect the client to do things that they don't want to do or they don't feel like they're capable of doing. You have to be realistic. You have to meet them where they are. So we're not heroes. We're not here to fix things. We're not going to swoop in and save the day. But we actually can do one better. I can support clients. I can be empathetic. I can hold space for them. I can help walk alongside them as they are trying to find a new identity, recover from trauma, walk through really challenging phases in life. I can be there for the client to help remind them that they're not alone, to help normalize things, to help them learn healthy ways to take care of themselves. I can do so many things that are far better than just coming trying to swoop in and fix it. And so that's where we need to focus on. And if you do that, you are going to feel less frustrated at them because you have a degree of separation and you're able to look at them as their own independent person, separate from you, that you don't need to fix, change, or solve, and that you can stay in your role and support them. So if you're feeling frustrated with a client, take a second, stop and reflect, think about what we've talked about in this video, and see if you can identify what's tripping you up. What about this situation is frustrating? What's happening for you in the moment that's causing you to continue to feel frustrated? What's going on with the client that you might be really struggling to accept or work through? Seek clinical supervision, talk to your supervisor, get some consultation around this, and work through this. It's understandable to have your own feelings and to sometimes be frustrated with clients. The important thing is to identify it, address it, and work through it so it doesn't negatively impact the work that you could do with that client. That's the most important piece. We're not striving for perfection. We're not saying that you should be emotionless. We're not saying that you should never feel frustrated. None of those things are realistic. I want you to be you. I want you to show up and I want you to show clients that you're authentic and that you're a human, you're not a robot, and that you have emotions and all of these things, and that you also are working through things. And in order to do that, you have to be aware of what's happening. You have to be in tune with those feelings. You have to seek consultation. You have to try things from a different perspective, and you got to work through it. I hope this was helpful for you. I hope that you've learned something from this experience, and I really hope that you can take this and apply it to your practice. If you haven't already, please subscribe and follow along so that you never miss any of the important topics that we come up and skills that you need to have in order to feel confident and competent as a mental health professional. All right, guys, until next time, I'll see you soon. Bye.